Hello, welcome to the Wales Violence Prevention Unit's first vlog post. My name is Lara Snowdon. I'm the Violence Prevention Programme Lead at the World Health Organisation Collaborating Centre at Public Health Wales, and I lead the public health activity at the Wales Violence Prevention Unit. In this first post, we wanted to talk about our strategic response to Covid-19. So the Wales Violence Prevention Unit was set up in 2019 through funding from the Home Office. It's an alliance of organisations who work together to take a public health approach to prevent violence across Wales. The core team include members of the Police Force, Police and Crime Commissioner, Public Health Wales, HMPPS, Home Office Immigration, and a range of organisations from the voluntary sector. You can find us on Twitter at WalesVPU, and our web address is violencepreventionwales.co.uk. So in this short presentation, we wanted to talk a little bit more about how we're responding to COVID during the current outbreak as an organisation working to prevent violence. So what we know from our partner organisations and their collective expertise is that COVID and the current lockdown measures are likely to be having an adverse impact on the scale, nature and the impact of violence, particularly when it's experienced in the home. Other types of violence that we normally work towards preventing and responding to, such as the nighttime economy violence, have largely been eradicated during this period. So as a new unit, we've been working to develop what our response looks like, and by sharing this information, we're hoping that we can support partners. So how can we understand this changing landscape during the pandemic? This short presentation describes the four strategic areas of action that we're looking at. So the first is data analysis and dynamic risk assessment through our violence surveillance system. The second is around strategic communications. The third is support and advocacy for frontline services. And the fourth is acting as a hub of information, guidance and evidence around violence prevention. In terms of evidence, we know very little about the association between violence and infectious disease, particularly in relation to the present pandemic and the global implications that it's had. However, we do know that the causation of violence is multifactorial, and therefore it's highly likely that a combination of risk factors that we're seeing during this period, so namely quarantine, potentially stress and mental health concerns, changes to working patterns, increased unemployment, closure of schools and support services, things like drug and alcohol abuse, among others, are likely to be having a significant impact on the risk and the scale and nature of violence, especially when it's experienced in the home. Concurrently, there's a loss in protective factors, so things like closure of schools, access to supportive friends and extended family such as grandparents, the workplace and other support mechanisms mean that those protective factors that are normally there in the community, people are unable to access those at the moment. So all in all, we think it's likely that there will be significant changes to the way in which violence is both being experienced and perpetrated. So types of violence that we think may be impacted by lockdown measures include increases in domestic violence and abuse, increases in domestic homicide, increases in sexual violence and abuse, increases in elder abuse, child abuse, increase in violence and abuse that's perpetrated online, possibly increases in self-harm and suicide, violences to and by emergency service workers and other key workers, increased risk and harm to specific vulnerable groups. We're likely to see changes to custodial and community sentencing, changes to patterns of offending and reoffending, and changes to violence relating to county lines, modern slavery and serious organised crime. In addition to the above, it's important to consider the potential impacts to violence when the lockdown is lifted. So there might be longer term consequences of this, particularly if there's considerable social and economic changes as a result of the measures, such as increases in unemployment, increases in poverty or increases in inequality. So these might be things like increases in nighttime economy violence, possibly civil unrest and hate crime, or again changes to violence which relates to county lines and serious organised crime. So I mentioned that our response has 4 pillars. The first is around data analysis. So we have a violence surveillance system currently in South Wales that we're working to upscale across Wales. And one of the things that we can do during this pandemic is start to bring partnership data together through our violence surveillance system. This will enable us to analyse and monitor the changes to violence, so changes to the scale, the nature of violence and its impact during this period. This will enable us to identify any trends, patterns and hotspots that are emerging as a result of the outbreak. Through this analysis we can do a dynamic risk assessment. We've developed a data dashboard that we're using to communicate weekly with partners. This ensures that preventative and response measures during this period are data-led, and it also means that we can add to the evidence base for future infectious disease events and how they relate to violence. In terms of data sources that we're using to feed into our violence surveillance system in this time, we're looking at data that is slightly broader than what we would typically use. So in our current violence surveillance system we use ambulance trust data, we use A&E data and police data. However, during the outbreak we're also aware that what we might call softer intelligence or professional expertise demand data, for example, from voluntary sector organisations, and intelligence on the narrative of violence from the outbreak that we'll get from perhaps social media, from blogs or news websites will also be really important to adding to our knowledge about how violence is changing during the outbreak. So in summary, we're bringing this data together, producing a data dashboard, which is our weekly monitoring report. We send this out to partners during the outbreak, and there's also a feedback mechanism through the dashboard for them to feed back data to us. So our second thread in our approach is around strategic communications. So because we're a collaborative multi-agency team and we take a whole systems approach, we're in a unique space to provide this leadership. So when I say leadership, I mean working with our partner organisations to both shape but also align evidence-informed communications. So we're working with partners to ensure that we're all working to the same key messages and not confusing the public with mixed messages. We also want to ensure that communications or social marketing campaigns are evidence informed and that they're also preventative. When partners are designing communications or social marketing strategies, we can also feed in data from our weekly monitoring reports and a violence surveillance system to ensure that comms campaigns are targeted at the right forms of violence and also at the right groups. So thirdly, our role is around supporting frontline services. So many frontline services responding to people who've experienced violence are experiencing unprecedented levels of demand during this period, and we're hearing this from our partner organisations. They're also coping with changes to capacity of staff as staff are off sick, and limitations around their regular service delivery, so moving online, for example. Again, we're in quite a unique position because we're a multi-agency team to be able to listen to our partners and provide both support and advocacy as well, to ensure that where there are gaps in the system, we're able to work together to resolve those. So we hold a risk register which we review weekly among our team and ensure that we're responding as effectively as possible. We also have services that we directly commission. At the moment those are to prevent serious youth violence in South Wales. Many of those services have moved online during this period, and we're working with those services to ensure that they can still work effectively as possible during these times. Finally, our last pillar of response is around being a hub of information, guidance and evidence. So this is a role that we play as the Wales VPU, but we continue to do this with a slant towards information that is being generated around Covid-19 and violence. So we're developing a special issue e-bulletin that will be issued very shortly. We're sharing resources and guidance, and we're developing a special webpage on our website which has all the most up-to-date content from a range of organisations, including the World Health Organisation, Welsh Government, UK Government, and we work together to share and disseminate that guidance with partners. Okay, so thanks very much for listening. In summary, that was an overview of the Wales VPU's strategic response to Covid-19 and the impacts that we think it might be having on violence across Wales. So thank you for listening. My name's Lara Snowdon. Please send me an email if you have any questions, and thanks for listening.